Inuktitut. I want to thank everyone, the organizers and everyone here this morning. My name is Natan Obed. I'm the president of Inuit Taprit Kanatami. I also want to just stop and pause and thank Monica for the work that you've done in relation to Upstream. Upstream is an excellent organization that I think shares, and I like to think of myself as part of this club, of this social innovation, and really this progressive movement in Canada to think not just in the way that we have in the past, whether it's around democracy or around the social tenets of society or health, but also just a group of like-minded people or people who want to get together and change Canada. Also, before I get going, I did want to thank my senior Indigenous Millennial Advisor, Max Finde. He's always there for me when I need him on the perplexities of youth in the Indigenous. So when Ryan was talking earlier, he was talking about stories. And what I'm going to talk about today is about where Inuit fit within Canada, and then also the way we've mobilized and how that impacts on reconciliation and health. But I first wanted to stop and think about when I was 13 and I was in the United States. I just moved to the United States. My mother's American, my father is Inuk from Nunangat. And my parents had separated, and I was on my first hockey trip by myself. And we're going to New Brunswick from Maine. And we crossed the border, and I was given the border crossing card, and I was dutifully writing in all of the information that I had. And when it came to citizenship, I put both. And in my head, that was really the only thing that came to my mind, not thinking that there were other countries other than Canada and the United States, and that putting both on citizenship really had no bearing on how a border crossing agent would have read it. But it was my place in the world, and where I thought I was American and Canadian, and I was just my imagination of who I was and how I fit within society had no other bearing other than those things. So as we have this conversation about the Inuit place within Canada, we then get back to the same kind of conversation. We as Inuit say that we were first Canadians, but also Canadians first. We don't have as much of the ongoing conversation about whether or not we are Canadians like other Indigenous people do in this country. And that is not to say that other Indigenous people should not be having those conversations. It's just to say it's a very different way of looking at the world that we have accepted. And now we're talking to Canadians about how Canadians can think about us. So we think about provinces and territories in this country. And for Inuit, you probably think about Nunavut. But Inuit live in 4 different Canadian jurisdictions. In the Northwest Territories, Nunavut, Quebec, and Newfoundland and Labrador. We call our homeland Inuit Nunangat, and Inuit Nunangat is about 36% of Canada's landmass, about 3.5 million square kilometers, and it comprises about 50% of its coastline. There are about 65,000 Inuit according to the last census. And those 65,000 Inuit live in 4 distinct land claim regions. We don't have historical treaties. We don't fall under the Indian Act. We fall under the most recent period of land claim and treaty era, the modern treaty era. And so the Inuvialuit settlement region, which was settled in 1984, Nunavut, which was an agreement signed in 1999, was 93 and then implemented in 99. In Nunavik, we have the James Bay Northern Quebec Agreement that created Nunavik, and then Nunatsiavut in part of Labrador. And that was the most recent land claim agreement in 2005. So together, they form a contiguous region. And this is important, especially when I talk later about the Inuit Nunangat policy space and the fiscal policy space and the way in which we should think about funding Inuit-specific investments in health. I also wanted to pause and give respect to the elected Inuit leaders in Inuit Nunangat, just so that you have an understanding of who they are and where they're from. Dwayne Smith is the president and CEO of the Inuvialuit Regional Corporation. Aluki Koitek is the president of Nunavut Tungavik Incorporated. Charlie Watt Sr. Was a senator and now is recently elected as the Makivik president. And Johannes Lamp is the president of the Nunatsiavut government. And Nunatsiavut is the only one of the 4 regions that has a self-government. We have an assembly in Hopedale, Nunatsiavut, and we run some of the health system instead of the province of Newfoundland and Labrador. These are the voting members of the Inuit Tapiriit Kanatami Board, and ITK is the national representational organization for Inuit, and it's located here in Ottawa. We don't have offices in any of our Inuit regions, and we take direction exclusively from those 4 Inuit elected leaders. But in addition to those 4 on our board, we have non-voting members. And those non-voting members are Nancy Kartek-Lindell. We have an Inuit Circumpolar Council Canada position. And we have Inuit are mobilized on a circumpolar level through the Inuit Circumpolar Council from Russia, Greenland, Alaska, and Canada. And Nancy is the chair of the Canada section. Rebecca Kudlu, the president of Paututit Inuit Women of Canada. There is a specific Inuit women's organization with its own board and with its own governance model, but Rebecca sits as a non-voting member on our board. And Ruth Kaviok, who is the president of the National Inuit Youth Council, and NIYC is administered through ITK, but they have their own governance as well, and she is elected on 2-year terms. Just to give a sense of Inuit in relation to other Canadians about our age, we are a young population. 33% of our population is 0 to 14. You can see that's almost twice the total population average. It's also from the 15 to 34 age group as well. We have a much higher population proportionately. And so about our median age is about 23. So you can see much less when it comes to 35 to 64 and 65 plus. And from a public policy perspective, that really changes what we focus on. It has a huge impact on the way in which we see our future and the way in which we mobilize and how we represent ourselves. We also have a growing non-Inuit Nunangat population. And so in 2006, our population that lived outside of Inuit Nunangat was just under 11,000. And now in 2016, it's 17,690. So it's a growth of 62% over 10 years. This also has great impacts on the way in which we think about delivery of service. Also, the trends for our population, which is urbanizing very rapidly. And for us, it also means politically, we have to think differently about how we represent those people. Because our status, if you will, is linked to our land claim agreements. So I am a beneficiary of the Labrador Inuit Land Claim Agreement. And no matter where I am in Canada, I have elected representation in the Nunatsiavut government. So with Inuit, each one of the 4 land claims treats their urban populations differently, but they are all linked back to the democracies in each one of those 4 land claim regions. At the national level, we work on ensuring that all Inuit across Inuit Nunangat and in southern Canada get the level of services that they need and also get the political representation as an Indigenous people as per our rights under Section 35 of the Constitution. So I also, just in setting the stage, I wanted to talk about our living conditions. And this is getting to the inequities that I think we're here to talk about. And if you can see that a median income between Inuit and non-Inuit in Inuit Nunangat is striking. So this is a slide of median income within the jurisdiction of Nunavut. And you can see it's a $70,000 annual gap in income. It takes a lot of doing to get to this space. And it takes systematically an entire jurisdiction that imagines there are two types of people that operate in this space. And then public policy and social policy is dictated around it. You see the earned high school diploma, we have about 34% of our population with a high school diploma in comparison to 86% of the Canadian population. Also, our employment rates are much lower, 47.5% versus 60.2%. And then our overcrowding is very pronounced. 52% of our people live in overcrowded homes as per the CMHC guidelines in relation to 9% of the Canadian population. Also, we have disparate health outcomes, and that wouldn't be a surprise based on the previous slide, but I'll just go through some of the things that are really striking. Infant mortality rates of over 3 times the national average. Food insecurity levels, 70% in Inuit homeland and 9% in Canada. Also, the lack of physicians, 30 per 100,000 versus 119 per 100,000 for the rest of Canada. Most of our population in our 51 communities are seen by nurses in health centers. And these nurses do as best they can. They provide basic coverage and care, but most of the serious issues that happen, health issues that happen in our communities, then are referred to either land claim centers like a Inuit or like Inuvik, but then mostly they go to southern centers. So for all of Baffin Island, it would be Ottawa that would be the service hub for any major health issue that happens within any of those 13 communities. In Nunavik, it would be Montreal. In the central Arctic, the central part of Nunavut, it would be Winnipeg. And in the western part of Nunavut and parts of the Northwest Territories, it would be either Yellowknife or Edmonton. So our healthcare happens in different places other than our communities. Our health centers are more referral centers than they are care facilities. And then all of this combines to a life expectancy that is over 10 years less than the Canadian average. And these are really difficult things to work on. These are all challenges that have been challenges for some time. But the way in which we work on these challenges has to come out of a respect for Inuit self-determination. In the past, healthcare has been delivered in a way, in a paternalistic way, in a way that imagines that Inuit don't have the ability to take care of our own people, that our traditional methods for healing are invalid. Our ways for caring for our community members in relation to mental health are invalid, and that the services can only be provided in a specific way and also cannot be provided in community. We do have challenges in relation to transportation. We only have a couple of our communities out of the 51 that have roads from our communities to the south, Inuvik and Tuktoyaktuk. The rest are fly-in, fly-out communities, and then in Nunatsiavut, there's a ferry service that operates in the summer. So you have 5 months of the year where you could get out on a ferry. It would take you the better part of a week to get to the south, where you could then get into a car and drive. But all that to say, we do have challenges in relation to our access to medical care and also the essential infrastructure in our communities. Getting to us as a people, we are known for having the strongest Indigenous language per capita. We have the second most Indigenous language speakers in the country. Cree have the highest level, about 80,000 Cree still speak their Indigenous language. But for Inuit, over 50% of our population still speak Inuktitut. And so we have roughly 30,000 of our 65,000 Inuit that still can speak Inuktitut as a mother tongue. But this is rapidly declining, and 58% in 1996, 50% in 2006, and 45% in 2016. Here's another snapshot, but just it gives you a sense of the regional proportions of this. 1% spoken in the home in the Inuvialuit region, 58% in Nunavut, 95% in Nunavik, and 5% in Nunatsiavut. This also is a product of colonization. It's a product of drastically underfunding or completely ignoring our mother tongue in all aspects of life. So if you can't get medical services, or if you can't get healthcare treatment in Inuktitut, if you can't get a job that encourages and promotes the speaking of your mother tongue in your homeland, if you can't go to school beyond grade 4 in your mother tongue in your homeland, if you can't receive the same level of communication services and media in your mother tongue in your homeland, if your language isn't protected and promoted the same way that English or French are in this country, this is what happens. And it happens at different times in different places, but it is a society that has decided that our Indigenous language is not worth keeping, and that dominant society will provide every avenue to ensure that Indigenous languages fade and are replaced by dominant languages over time. This has tremendous impacts on our health, on our ability to imagine ourselves as Inuit, on our ability, and it also has tangible outcomes on our health for healthcare delivery. We still have a generation of unilingual Inuit who have to have medical interpretation for any of the visits that they ever go on. But just imagine how much is lost between the care provider and the person seeking care when they're speaking a unilingual language that the care providers not only don't know, but have no systematic way of describing their health conditions or the world to the patient. It's as if you had something wrong with you, you went to Mexico and had services in Spanish. It is the exact same thing. But for us, it happens here in Canada, and it happens as a matter of course within our own communities. It isn't an exceptional thing. So what are we doing about it? So ITK is mobilized nationally. We are the national voice of Canadian Inuit. We are the national component of the Inuit democracy. ITK's sole function is to work on priority areas that Canadian Inuit have dictated us or through resolution decreed that we would work on their behalf. One of the key points is the creation of our strategic plans, and the one that I am in the process of implementing as president is the one that was passed in 2016. And in it we have 7 specific areas: housing, suicide prevention, reconciliation, healthcare, research. And along the way we have points in time of success. And so I wanted to talk just about a few of the successful things that we've done over the past few years that lead us towards self-determination. And self-determination as a key component of reconciliation is a concept that we all should have the same idea about what it is. And that it's basically that we need to refigure the way this country works so as to respect Indigenous self-determination. The idea that Canadians get to decide how reconciliation works, or how these gaps that I talked about are overcome, is still working under a construct that needs to change. And this government is trying a little bit better than other governments have in the past to figure out what that means, but it is a lot slower than any of us would have hoped. That said, ministers like Minister Philpott, who you'll be hearing from later this afternoon, have done great work with us on specific areas. In 2016, Minister Philpott and I announced the release of the National Inuit Suicide Prevention Strategy. Last year at this conference, I went through an in-depth conversation about this strategy, but it basically, for the first time, articulates why there is higher rates of suicide in the Inuit population, what the reasons for that are, the protective factors and the risk factors that we know, and then outlines specific actions that are necessary to prevent suicide among Inuit from this point forward. We received $8 million over 3 years on day one of the strategy, and we are in the third year of the implementation of our strategy today. We just released a National Inuit Strategy on Research, and this also links back to self-determination and health. In budget 2018, we received $80 million from the federal government to create a sustainable Inuit health survey. This is a component of the implementation of the National Inuit Strategy on Research. But the larger picture within the research strategy is about the fundamental place that Inuit have within research, within government, and within academics, and within the research community itself. The fact that no Inuit have ever sat on any governing councils for any of the Tri-Council or any of the research agencies of this government shows you where we are at this point in time. The fact that we don't think that there are any Inuit that serve on ethics boards in any major government or research ethics boards across this country shows you what a massive gap there is within the research community. It's as if the research community is really a generation behind when it comes to reconciliation in the structures. There are very progressive people that are working in partnership with Inuit, but the systems need to change. Lastly, I'll just touch briefly on the United Nations Declaration on the Rights of Indigenous Peoples and its implementation in this country. We put a position paper out last year that calls for an Indigenous human rights body that would sit beside the other human rights tribunals in this country to specifically remedy the continuing human rights abuses or that Canadian Indigenous people still face, that other tribunals have not been able to focus on or work on hard enough. Also, that the legislation in this country has to link in with the tangible and just logical way in which a United Nations convention or declaration fits domestically within Canada's legislative framework across this country, from provinces to territories to the federal government. We can't just skim across the top of reconciliation and health. We can't just skim across the top of what it means to be a party to the Declaration of the Rights of Indigenous Peoples in this country. Yet, here we are talking about these same issues as if it's a good to have. It would be great to have health for Indigenous people. It would be great to have greater Indigenous language services. We need to reframe the conversation to allow for us to expect this government and all governments across this country to dutifully implement the way they would a Declaration on the Rights of the Child or on other United Nations processes. It isn't enough just to say that you want to reconcile. It is the duty of this country now to live up to its expectations the way that it would anything else. So I really appreciate the ability to speak with you here this morning. All of this is the larger foundation for what our health can be built on. And the longer that we muddle around within the edges of reconciliation, the less that we actually get to systems and to respect for Indigenous peoples and our institutions and our democracies, the more we are going to waste this opportunity in this moment. Nakamik.